what chromosomal abnormalities are, I ask you to pay attention to this, the photocopy that you had on the theory. And in this photocopy, you had different pictures representing the karyograms. Bueno, vamos a ver si nos centramos. First of all, what is the definition of a karyogram, or how would you define this karyogram? Any idea for the definition of a karyogram?
It's like a photo of your chromosome.
Okay. Okay, perfect. So they take a picture of the chromosomes in your cells and they organize them. And we said that in order to organize them, what we do is we put them in order considering their size, how big they are. And we're going to find two chromosomes that are going to be larger. They are pair number 1, then two chromosomes a little bit shorter, then shorter, shorter, and so on. And this is the karyogram representing your karyotype. The karyotype are all the characteristics of your genetic information. So whether you've got a right number of chromosomes or a higher or lower number of chromosomes, whether your chromosomes are all of them 2 by 2, the homologous chromosomes, all of them are the same size or they are smaller, because there are some abnormalities that are led to one fragment of one chromosome that is absent. So the karyotype will also give me that information, and of course it tells me whether it's a boy or a girl that this chromosome belongs to. Aquí tenemos a Andrés. Well, first, Victor, which part should I circle? Where do I have the abnormality in this picture? One volunteer.
That there's only one Y.
There's only one Y. Is there any problem because I only have one Y? There's not.
It's because of the 2X? Or...
Well, there's, in fact, none of them would be a problem. Having 2x like this is not a problem. It means that you are
a girl.
A girl. Having the y, as he said, is not a problem. That would mean that you are a boy.
A boy.
Okay, but the problem comes when you've got 2x and a y, because you've got an extra chromosome. Instead of having 47 chromosomes, you've got 46 chromosomes, you've got 47 chromosomes. Then we say that you've got one syndrome. No, this one is Klinefelter syndrome. It is a different syndrome. So the one that is the most famous one, that probably that most of you know, is the Down syndrome, but not all the chromosomal abnormalities led to this Down syndrome. Only one that is very specific is going to give me this syndrome. So the only activity, the only thing you had to do for today was just marking this part that contained the irregularity, because it has 2x and a y. Well, if we go back to this picture, the second one, this one seems to have no problem because it has one x and one y. So, Andres, is it a boy or a girl? The karyogram represented here, does it belong to a boy or to a girl? Andrés, it goes for you. Nada, está dormido. Carlos, would you mind helping him? Does it belong to a boy or to a girl, this picture? Jorge knows it. Jorge, does it belong to a boy or to a girl?
A boy, I think.
It's a boy because it has one long chromosome, that is the X chromosome, and one short chromosome, that is the Y chromosome. So it belongs to a boy. But does this boy have any chromosomal? Yes, it's a boy. Does it have any chromosomal abnormality, this boy?
The 13.
Okay, if you see this pair is not a pair, in fact, is 3 chromosomes. So 3 chromosomes, that is a trisomy, and it's a trisomy in chromosome number 13. So we'll see later what's the name of this chromosomal abnormality, but I wanted you to see that, at least see that there is one abnormality. Well, let's see the following pictures. This one on the left. Andrea, where is the abnormality in this case? I've got 2 sex chromosomes, an X and a Y. So, Andrea, what is the sex of this organism?
It is a boy.
It's a boy, and it doesn't have any problem in these 6 chromosomes, no problem in chromosome number 13. Where is the problem?
In the 18.
We've got a trisomy, triple chromosome in number 18. So we're going to see that that is a different syndrome. What about this one? Where is the problem?
What was the name of the first abnormality, the one with 2 X and a Y?
It's Klinefelter, but we are going to see all of them. Vamos a ver todas despacito, so
vale.
do not worry. This one, where is the problem here?
2x again.
We've got 3x instead of 2. There's 3 long chromosomes. So that is another abnormality. It's different from the previous one. In the previous case, in this one, there's 2 long, 1 short. But in this case, there's an extra chromosome, all of them long, so 3x. This, is it going to be a boy or a girl? This one, what do you think? No se animáis ninguno. Bueno, buen intento, pero 50%
pero no.
You failed. It's a girl because we only have boys if a Y is present. Okay, that's what you've got to keep in mind. So in this case, first one, do we have a Y? Yes, then we've got a boy. In this case, do we have a Y? Yes, then we've got a boy. In the following case, is there any Y? Yes, that's a boy. But in this case, because there's no Y, that's a girl. Okay, it's going to be a girl suffering another syndrome, but this one is not very dangerous. It's not going to have a lot of pathologies going with it. What about this one? What's the problem with this one? Does it have 46 chromosomes? No, there's only one X, that's right. There's only one X here, and there's no second X or Y. So is it a boy or a girl?
Girl.
A girl.
It's a girl, great, because it doesn't contain any Y chromosome, okay? But it's going to be a girl with Turner syndrome that is a little bit more complex than the previous one. And then we've got this one. What's the problem with this one? It's a problem again in the sex chromosomes because we've got an X, but we've got 2 Y. Is it a boy or a girl?
A boy.
It's a boy because as long as you've got 1, you've got a boy. If you've got 2, you've got a boy as well. Okay, so this one belongs to a boy. And then we've got this one that is the most famous syndrome, that is Down syndrome, in which chromosome number 21, instead of 2, there's 3 chromosomes in number 21. one. Thank you, Victor. This one is long. That one I would say is long as well. So I would say this is a girl that has this Down syndrome. Well, I'm going to show you different chromosomal abnormalities today, but I don't want you to panic, okay? Because we're going to see loads of different names and loads of different characteristics for each syndrome, because I must tell you, but you don't have to study all that. What you've got to study, what you need to know is being able to join the name of the syndrome with the karyogram. So if I give you one karyogram, like the first one, you've got to tell me that it belongs to someone with Klinefelter syndrome. This is the name that Lucia was looking for, Klinefelter. That's the name of the syndrome. And it belongs, you need to be able as well to tell me that it belongs to a boy, because there's a Y there. That's everything that you will have to tell me in the exam, okay? Apart from that, I'm going to tell you more consequences, common consequences of these disorders, and whether they are common or not. In the case of Klinefelter syndrome, is a quite common syndrome. It appears 1 out of every 1,000 males, okay? So it's not so strange. Think that in Toledo we've got 70,000 people, so half of them are boys. We could have 4 people having this syndrome in our town. Not so rare, it's not one in the planet, it's quite common, okay? It's obviously not the most common, but it's quite common. It's going to belong to a boy, and we are going to see that the physiology, the appearance of this boy is going to be a little bit special, but not very rare. They're going to be a little bit taller than the average. They are going to, the baldness in them is not so rare, but they have very poor birth. They have some characteristics that are similar to girls, is what we've got here, a slightly feminized physique, but that is quite common, okay? Not every boy has a very, what we consider male appearance, with a lot of hair and being very tall and with a low voice. Well, that's not common in every boy, of course. So it's quite common to have this slightly feminized, what we call a slightly feminized physique, or that having a poor beard. Sometimes in 30% of the cases, but not in every case, there's a little bit, a little development of this breast, some illness that affect mainly girls, like osteoporosis. It could appear here, but I can tell you that there's people having this syndrome and they don't know they have it, because it's not going to have important consequences. Like, you're not going to have heart pathologies or kidney pathologies that go with it. You're not going to have that's what you've got here. You can have a shorter IQ, but sometimes it's not so important, so you don't even notice it. They are going to go to school, they're going to pass probably secondary, and they could even go to university having no problems, okay? So most people don't even notice it, but because they may suffer infertility, that's not common for everyone, but some of them are infertile, they only realize they've got this syndrome when they want to have babies, and after several months or maybe several years trying to have these babies, if they go to the doctor, most of them they don't, if they go to the doctor, to a fertilized clinic, then they are going to do this analysis and they will realize they have an extra chromosome. But until they were 35 or 40 and they tried to have those babies, they didn't know they had an extra chromosome. So it's not very dangerous, okay, this one. So it would be represented, as we saw, with this double X and a Y. And because it's a Y, it belongs to a boy. Remember, it's important that you identify it, give it the name, and know that is a boy. This one is more complex.
Profe.
Dime.
¿Esto nos lo vas a dejar en
Sí.
En el aula virtual? Vale,
Sí,
por si
pero,
acaso.
vale, pero no os volváis locos intentando
Ya.
saber esto,
Bueno,
ni mucho
para
menos,
saber más o menos.
ni mucho menos la ratio de cada uno, ni, o sea,
No, ya
os
sí, es
volváis
más o
locos.
menos para acordarme de qué era cada
Sí,
cosa.
eso es. De todas formas, they are in order. So you can take your photocopy and write down the names in your photocopy because it's what I want you to recognize.
Vale.
The pictures. Okay, so the first one is the Klinefelter symptom. Second one, trisomy in chromosome number 13, is Pato syndrome. Well, Pato syndrome is not as famous as Down syndrome because of one important problem, that it affects many less people, 1 out of 20,000 live births, but most of them die before being born, so they are natural abortions. You get pregnant, you've got this baby, but when the baby is in your womb and you are 5 or 6 months pregnant, then you've got a natural abortion. The baby dies because it's a very complex syndrome, this one. Even if they are born, more than 80% of them die within the first year. That's why you probably don't know any baby having this syndrome, because it's not very common and they don't get older. So you're not going to see them at school because they don't
Y
reach.
nunca, entonces no hay nadie que lo tenga.
There's no adults
¿No?
having them, but there's younger children having them. This syndrome. There's young children. They could live up to 5, 6 years old, but most of them die within the first year, even within the first week. Okay, so it's very common that they are born, but they die very soon, even before leaving hospital. No se llegan a ir del hospital and they die. Because apart from this physical appearance, which is what I have here, I've got this cleft lip that is joint, there's no bone there in the palate. They've got this special shape of the ear. Most of them have an extra finger. There's not 5 fingers, but there's 6 fingers. There's abnormalities in the testicles and in the shape of the legs. The eye is also special. They have common special characteristics, but more than that is that they have other problems in the circulatory system. They have problems in their hearts. So it's very common that very soon their heart stops and they just die. It could happen within the mom womb, but it also happens after being birthed very soon. Okay, so this pattern. Dime.
No hay ningún adulto que tenga, o sea,
Bueno, yo que sé, me hacéis unas preguntas de así,
No sé,
ninguno,
profe.
ninguno, pues a lo mejor alguno, ahí busca luego en Google y seguro que alguno ha sobrevivido en algún lugar del mundo, pero it's not common, okay, because they have a lot of problems in their hearts. Luego lo buscamos, me buscáis a ver si me podéis dar una buena noticia de uno que sobrevivió, ¿vale? So we've got this Pato syndrome in chromosome number 13. They could either be boys or girls, no difference, okay? Next one that you've got in your photocopy is the trisomy in chromosome number 18. That is Edwards syndrome, and it's another one that is very dangerous. This one is a little bit more common. So it's 1 out of 6,000 live births. 80% of them, most of them are female. We don't know why, but that is a statistics that most of them are female. It could be because female survive longer. Sometimes it's just because of that, because male fetus die within the womb, but we don't know. Because most of the fetus, in fact, they die before they have birth. Again, the incidence, that's very important, increases as the mother age increases. Okay, when you are more than 40, you are more likely to have a baby with any of these syndromes. They always mention Down syndrome as a possibility when you are more than 40, but there are many other syndromes which incidence also increases with the age of the mother. The age of the dad is not so important, but the age of the mom is very important to increase the probability on having this syndrome in your baby. Again, a very low rate of survival, and they have a lot of heart abnormalities like Pato syndrome, but they also have kidneys malformation, other internal organ disorders. So again, they are going to die very soon. They've got this 5 fingers, but when not being able to control their hands because they are very young, they've got this special way to close the hand with these 2 fingers on the top of the other 2. That's a special pattern that they have. The shape of the head is also special. The shape of the thorax, the shape of the ear, they are different characteristics that are very common, and the position of the feet as well, that they are very common in this Edward syndrome. Okay, this case would be a boy suffering this Edward syndrome. So these 2, Pato and Edward, are probably the most dangerous syndromes that we are going to see. We saw Klinefelter, that is not dangerous at all. Pato and Edward, that unfortunately they are very linked to other pathologies, so they have more difficulties to survive. And then we've got this one, that is the triple X, sometimes known as superwoman. This triple X is once every 1,000 female, so again quite common, the same rate as Klinefelter syndrome. And again, we usually do not differentiate this woman from the rest of the population. Some of them are taller than the rest of the people, the rest of the female population, but that's it. There's no differences in the physical appearance apart from being a little bit taller, and they're not going to have many consequences.
Uy, Andrea.
Many pathologies. Well,
¿Pero qué te pasa?
probably she has told people in her family. But anyways, in case she had it, well, there's no other consequences. So who cares? Sometimes they could have some of these characteristics, but not all of them. Okay, so some of them could have these special characteristics in the face, but not easy to recognize them. The skin has a special pattern. Some of them have problems in the aorta or poor breast development patch. Not all of them in the same person. Okay, so no distinguishable difference between women having this triple X and the rest of the population. Very common. And sometimes they can even be fertile. So as I told you, boys having this Klinefelter syndrome, they realize when they want to have baby and they can't. But there's women having this triple X syndrome that will not realize all along their life, because personally, I do not know how many chromosomes I have because I never undergone a test to analyze the number of chromosomes that I have. So who knows? Okay.
¿Y estos nunca tienen ningún cromosoma en la Y?
No, three X chromosomes, so they are girls. This one, they are girls. Okay, and they got their ovaries, and most of them have ovaries that work. Okay, so they could even have babies.
Entonces, este se llama triple X.
Triple X, sí, le podéis llamar Superwoman or Triple X, se llama así de las dos formas. This one is a little bit more complex, este sí. Turner syndrome is the one that appears when you lack of the second sex chromosome. So you only have one X, but you don't have the second one. It's not so common. So 1 out of 2,000 or 3,000 females. But in this case, you do show more differences in your physical appearance, okay? They are shorter, they have this special shape in the neck, the position of the hands by nature is different, and they are wider, so they retain liquids there. They're going to have special characteristic, okay? And they sometimes they also have differences in the IQ. No sé si viene por aquí. No. Así que no lo vamos a ver. And most of them are not fertile. None even have the period, okay? They don't have menstrual cycles, so they are not going to have babies. But in this case, you do realize that you've got this. It's also linked with many other problems like heart disease, hypothyroidism, visual problems, hearing concerns, hearing problems, autoimmune disease. You've got those problems that you've got to cope with, but you will survive, okay? You will probably need to visit the doctor more frequently, but you can have a normal life. And even though the life expectancy is not the same as ours, okay, your lifespan, your life expectancy is 80 or 85, creo que estamos ya por ahí, their life expectancy would be shorter because they have all these problems, but might be 50, okay? So they could reach 60 or 70 with no problems, okay? It's not the same as the other two that they die when they were babies. People having Turner syndrome, they could become adult with no problem, okay? They only have an X, and then we've got this one, XYY, that is very similar to Klinefelter in the sense that the rate is similar and the consequences are not dangerous. But in this case, it's even less dangerous because most of them do not show any physical difference or any medical problem. That's why I don't have a picture for this one. I just have the karyogram, but there's no picture representing XYY because there's no physical difference. They could be a little bit taller than the average, as we said with Superwoman. This XYY, they could as well be a little bit taller than the average, but that's it. No other special characteristic. And then we've got this Down syndrome, that is trisomy in chromosome number 21, in which the incidence was estimated several years ago, 1 every 700 births. When I did this presentation several years ago, it was 1 out of 700 births. The rate gets more common, so it could be 1 out of 500s, so less, 1 out of a lower number, so get more common when the parents are older. Unfortunately, the rate of these births is decreasing. Y cuando yo digo esto, uno dice, pues mejor, ¿no? Now it's not 1 out of every 700, but it's getting 1 out of 10,000. Well, why is the number 2,000? Why is the number increasing? Why do we have it 1 every 2,000 births now? Because we usually diagnose this Down syndrome, and you know that you can provoke the abortion of this fetus. So what they do is they don't let them being born, and then they are not going to be in their statistics. But it's not that we remove we are able to remove the chromosome. Is that we...
O sea que normalmente no suele cambiar esto, ¿no? O sea, las estadísticas.
The statistics nowadays, they change. If you see
Pero
the
por otras
statistics,
razones, ¿no?
pero cambian because we are talking about how many of them are born, and now there's less people with Down syndrome being born. But they are not born because we don't let them being born, okay?
Eso es porque la mujer aborta
Claro.
cuando sabe que tiene el síndrome.
Claro, as long as you know that you've got this syndrome, you provoke the abortion, and then it's not going to be born. And then you diminish the rate. Pero no es que sepamos curarlo, quitarlo, no es solo que decimos, pues así hay menos, ¿no? If you see the rates in what we call modern countries, ¿vale? The rate is diminishing a lot. This is not a part of the biology class, but I wanted you to be concerned with all these syndromes, because sometimes we panic when we think of having someone with these syndromes in the family. But if you ask me what's the biggest problem on having someone with Down syndrome in my family, would probably be all these diseases that they have, that usually have having the syndrome. So they have problems in their heart, they might have problems in the digestive system or in their kidneys, but they could have an almost normal life. And we've seen it because they are in school and they go to normal school, they could have a normal job. So it is true that they will suffer. Of course they will, because they will have operations probably very soon. When they are children, they will probably undergo operations in the heart. But these problems may appear in someone that seemed to be healthy at the beginning, that did not have any syndrome. So it's better if you know that your baby has the syndrome. Would I like to know whether my baby is going to have a syndrome, one of these syndromes, or not? Well, if it seems to have it, I would like to know what is the syndrome. But why do I want to know it? In order to be prepared and to give the right treatments, okay? Because these people are just people. They have the same rights for being with us. And that's important that we consider that before it comes to my family, because it just comes and you've got to take all the decisions very quickly. So it's better if you think about this before it appears in your life. So that would be the karyotype of, what do you think, male or female? Having this Down syndrome, male or female?
Boy.
Is it a boy? Is it a boy?
Female.
Ah, no, es a girl. Es que está tan junto que no.
Vale, pero no me han puesto la I para asegurármelo. Okay, it's double X, so that would be the karyotype, the karyogram, if I'm referring to the picture, the karyogram of this person with Down syndrome. Okay, so this presentation... Dime.
Y no sabemos cómo curar los síndromes con cromosomas.
No sabemos, fíjate, porque por lo complejo que es. Voy. When does the syndrome appear? ¿Cuándo aparece? As soon as the zygote...
Sí, se divide.
As soon as the zygote is formed. So if I have this is going to turn into the zygote of someone suffering the Down syndrome. Why does this person have this Down syndrome? Because one of these gametes, I don't know which one, it could be the one that belongs to the mom or the dad. We're going to say that is the mom, that instead of 23, it has 24. And then we've got these 23 chromosomes from the dad. When this sperm cell the nucleus enters this, instead of having these two nuclei join, and instead of having 23, I would have 47 chromosomes. Aquí, 47 chromosomes. This zygote will start dividing, and when it divides, it's going to form two cells, each of them with 47. No? Each of them identical, each of them with 47 chromosomes. This second, these two cells will divide again, and then I will have all of them with, all of them with 47. So by the time it will go on doing the division, and then all that is happening in the fallopian tubules. By the time this embryo nests in the uterus, it will already have 32 or 64 cells, all of them with 47 chromosomes. Then it goes on, and then you realize that you are pregnant, you already have a tiny, very tiny fetus there, and then you analyze the genetic material with amniocentesis. So you analyze the material in the amniotic liquid, and you realize this boy or this girl has 47 chromosomes in each cell. Is it possible to take every cell of this person and remove one chromosome from it? No way. No way. So it's not possible to remove it. What are scientists doing? Well, what they can do, and in fact they do it, is when there is artificial, if there is artificial reproduction, what they do when you are likely to have one of these embryos because you are quite old, what they do is they take different ovules artificially in the laboratory. They take different ovules and they fertilize these ovules. And then after fertilizing several ovules, if one of them is, instead of 47, this one is 46, what do you think that is the embryo that they are going to set in your uterus? This will be the selected embryo. They will do, this zygote will do several divisions, and then they will nest artificially this embryo in your womb. They do it with the one that contains the right number of chromosomes. But in order to see, fijaos que esto es importante, in order to see the right number of chromosomes, ¿cómo los vemos? When are chromosomes visible? When the cell is, esta es de este tema, when are chromosomes visible? Cuando se ven y se pueden contar. Vamos, chicos. If the cell is not dividing, this nucleus will contain, if the cell is not dividing, this nucleus will contain 47 molecules, but I will not see them. If I want to see those molecules, I need to wait until the cell is dividing. So they usually wait several divisions and then they analyze one of the cells. So the way they reduce the number of individuals that have this syndrome is they only put in your womb the embryo with the right number of chromosomes. ¿Vale? Entonces, are you reducing the number of individuals? Well, that is another ethical concern because it depends on whether you consider that this that already has 32 cells, is it a human being or not? For people that consider that this is only a group of cells, but it's not a human being, then there's no problem, because the only thing that you are doing is this group of cells will never be inside a mum. But if you consider that this, having all the genetic information, is already a human being, then what you are doing is selecting who is going to have the possibility of having a life and who is not going to have this possibility. But it's an ethical concern depending on whether you consider this a human person, if it's a group of cells working together and with all the genetic information. If you consider it's a living thing, the only living thing that it could be, it's a human. But if you don't consider that it's a living thing, then you would have no problem deciding whether this individual can have a life or not. Can you see the difference? Es que hay mucho. There's a lot of ethical concern here, because we've got these two things in the balance, whether to be born with an illness is doing you a favor because at least you can have a life, or if it's better to just kill you so you will not suffer the illness. Bueno, así que a lo bruto dicho así parece que no tiene mucho, pero there's a lot of ethical concern here.